You're listening to Happy Healthy Hormones with Dr. Chris. Are you tired of the short-term patch to your health problems? Is avoiding medications and surgeries important to you? If you answered yes, then your prayers have been answered. Dr. Chris has been helping people transform their health for over a decade. He's a world-renowned health expert who specializes in holistic health. He's a professional speaker, chiropractor, and international best-selling author. It's his mission to help you reach your full God-given potential through holistic health and healing. Get ready to be inspired and transformed. Here's your host, Dr. Chris.
Hey everyone, and welcome to the show where disease takes a dive and people come to thrive. Today I'm going to be talking to you about a problem that is running rampant in our country. It's affecting over 30 million Americans every year. Over 7.2 million people were undiagnosed with this. We're talking about diabetes. We're talking about type 2 and type 1 diabetes because guess what? It's not just about the sugar. There are other factors that are creating diabetes in people that people aren't even aware of, and they are getting sicker and sicker. They're taking medications, but they're not really addressing the cause, right? And so this is a huge blockbuster industry. I mean, there's $245 billion spent total costs and diagnosis of diabetes, and it's just gotten more and more rampant, and it's going to continue to increase with the projections of diabetes on the rise exponentially, in fact. And so when we look at it, there are over 1.5 million Americans are diagnosed with diabetes every year. 84 million Americans age 18 and older have prediabetes. It's the seventh leading cause of death. And, when you look at it, we can continue to put off the symptoms. When diabetes shows up, the average person already has it for 7 years before they even get diagnosed. We can have symptoms that seem like they're not that big a deal. Hey, I can deal with it type of mindset, attitude when it comes to some of these symptoms. But the fact is, the longer we go on with this, the more we think we have it, quote unquote, managed. You would be surprised how many people I have come in to see me in the clinic that say, hey, doc, no, I don't have anything wrong with me. And I'm like, hey, you sure nothing wrong at all? Not any medication for anything? Oh, yeah, by the way, I guess I do take medications for diabetes, but I manage it's under control with this medication. That is not fixing the issue, right? That is just putting a patch. And the longer we have a patch on something, the worse things get. And while you temporarily might be feeling better, the long term, people are just getting more and more sick. So, it takes me back to this story of several years back, there were this husband and wife that came in to start to get help. They were struggling with, amongst some of the things, diabetes, weight, neck, back pain, headaches, that sort of thing as well, and neuropathy. And the wife, they both came in, they went through the exam, we figured out what the issues were, what they needed to do to start to change some things in their lifestyle, start to implement some more advanced strategies to get some of these things under control. And the wife, she started care. The husband did not. And so she started to make all kinds of change. She was feeling better. She was able to be more active. She was getting into exercise again. Just a whole bunch of her life effects changed for the better. But her husband continued to go down a spiral and continued to get more sick. His diabetes got more out of control until over the course of about a year, he ended up having to get both of his legs amputated off. And within less than 2 years, he was dead. And, there was a chance where he could have just started to reverse that process, gotten better, and had many, many, many more years of quality life with his wife and grandkids, and now no longer. In fact, that problem that he went through, and with all the doctor's bills and everything else, had to get into an assisted living home during that time, wasn't covered by Medicare because of what was going on in his life, and it put his wife, who ended up being a widow, financially as well as emotionally distraught. And so, why do that to yourself? Why do that to the people in your own life? Because right now it might not seem like a big thing, but let's fast forward a year, 5, 10, 20 years. It's a lot bigger issue. In his case, it was only less than a year's time before it turned from a concern to him, before it turned into a crisis. And at that point, I can't help it when it's at that crisis point. That's where the medications and surgeries come in, and they don't always work out that well. So when you look at the complications from having diabetes, they include things like all kinds of skin problems, autoimmune diseases, hearing loss, neuropathy. Again, we talked about the guy that just had to get his feet amputated off. You can go blind, kidney damage, nerve damage, which creates all kinds of pain and problems in your body. I mean, you want to think about chronic pain and being miserable, have nerve pain. And then also heart and blood diseases as well, blood vessel diseases. It's just, I mean, the list goes on. And then what happens with a lot of people is they start to have some of these symptoms that maybe start off as just, slight symptoms, but then they just start to reach out for that medication, right? And if you've ever looked at the side effects of those medications, a lot of times they are worse than the thing you're actually trying to get rid of or you're trying to cover up, right? If we're really being honest with ourselves. When you look at the medications, the most common medications that people take for diabetes include things like the side effects: liver disease, fluid retention, weight gain, increased risk of fractures, increased risk for bladder cancer, for risk for ovulation, which can result in pregnancies and weird things going on with pregnancies, headaches, hives, all kinds of skin problems, a lot of autoimmune things like we talked about, urinary tract infections, UTIs, all kinds of infections, in fact, even things like vaginal yeast infections, penis infections, bronchitis, all kinds of infections can happen from this, facial swelling, GI problems, interference with your body's ability to absorb B12. So if you can't absorb B12, your energy is going to be tanked and you're going to be hating life. And then more bladder issues, kidney dysfunction, and hypersensitivity reactions too. Now, when we look at all the things that are created from diabetes, 95% of diabetes is avoidable, whether it's type 1 or type 2, because right now, here's the problem. More and more people are getting exposed to things that are actually creating type 1 diabetes. Now, type 2 diabetes is definitely more of a lifestyle related, but also type 1 is now found out to be a lifestyle related thing too, meaning it's about your environment. So toxicity plays a role in this. So we're going to talk about that in a second as well. But the fact is because these things are avoidable, you can get off the medications. You can reverse that diabetes process in your body, but it's about doing the right things. And it comes back to that consistency that I'm always talking about, right? It's about drawing that line in the sand, stepping over that line, and not coming back. And that's key. It's just like, we want to learn from our mistakes in the past. We don't want to dwell on our misfortunes or our bad mistakes we've made in the past. They're in the past. We can't change that. When I ask people, hey, when's the best time to start taking care of your health? People sometimes say, well, yesterday. And I have to disagree with that because yesterday we can't change. So that's not a time to look back and say, oh man, I want to change that, because you can't. But today you can. Taking care of yourself today. Now, it reminds me of a patient I had named Mary, and Mary was on all kinds of diabetes medication. She was on insulin. She was on metformin. She was getting in like those injections, and she had like a pump on her. It was just crazy. She was severely overweight. She had to basically start to close herself off, was not doing anything. She was not able to serve at her church. Was a real passion of hers. She liked to give back and serve and be around the community and things, and she just couldn't do that. And she was on that track to be medicated, kidney dialysis, all those things, and her life was just plain old miserable. And so we started to change some basic principles. We started to rebuild the foundation of her health. We started to look at her nutrition. We started to look at toxicity in her life. Started to give her some avenues that she could start to implement some more advanced strategies to get the diabetes under control. And she started to reverse that process. In fact, in just a week, she started to see her insulin levels, her blood sugar levels, I should say, drop. She was starting to get more energy back. And I mean, it's amazing what happened. In fact, over the course of just a couple months, she was off of all of her medications. She ended up losing like 50, 60 pounds and just got her energy levels back and was able to get back to serving at her church. And she got her purpose back. And when you get your purpose back, that's huge, because nothing else really matters in life if you don't have a purpose. And when you're just sick and miserable, it's no fun at all. So what are some things? What are some of those strategies that we implement with Mary, that we implement with our other patients that help them start to get back their health. They help them sort of get off those medications and free themselves of that diagnosis. Because if you just identify yourself as a diagnosis, you become it, and that's really hard to get away from that. So you are not that diagnosis, but let's look at it. Eating principle is really simple. You've got to look at it and understand that you got to get the sugars out. It comes in all forms. It comes in the processed foods you're eating. It comes in the grains, the pastas, the rice, the gluten-free things you think are good for you because they say gluten-free. Well, guess what? They still have sugar in them. So you got to really just clean that up, really stick to the basic principles. It's pretty simple, but you look at lots of green leafy vegetables, get a lot of those in, limit the sugar intake, even in the fruits, limit that as well, and making sure that you are putting in the good proteins as well, and that you're not eating at wrong periods of time that are going to spike your insulin level. So you're not going to eat right before you go to bed, right? And if you are going to eat something that maybe has a higher sugar content, you're going to do this right before you work out, right? So your body can burn that excess sugar up. But that's so key. I mean, just eating at least 50% of your plate, green leafy vegetables. One thing I also like to do, this is a short-term fix, but it's a short-term fix in the sense that it's natural, and it doesn't have to require you having more medications while you're trying to go through this transition, which is using essential oils. I love cinnamon, clove, rosemary, and thyme. You can make a tonic with those with your essential oils. And rub those around the area of the pancreas, even the bottom of your feet. It'll help keep that blood sugar level at bay. But again, it's just still not a long-term fix, but it's still something that you can do naturally to help alleviate some of those things and not have to put those harmful chemicals in your body. But one of the biggest things we see is toxicity. If you can get the toxins out of your life, that'll be huge. Right now, people are getting exposed to more links between pesticides, herbicides, all kinds of different chemicals out there that are actually creating autoimmune diseases, and that's what type 1 diabetes is. It's on the rise. It is growing by like at least 6% each year. More and more people getting diagnosed with that. Just another form of diabetes, and even toxicity can lead towards the type 2 diabetes as well. But if you are toxic and you are continually putting those things in your body, then you're in trouble. And let's say you've identified where you're putting toxins in your body, but you haven't gotten them out of your body because these things bind to your fat. They lodge deep inside the brain, inside around the organs as well, because those are surrounded by fat. And it takes a lot sometimes to get those toxins out of your body as well, especially if they might be things like heavy metals, biotoxins, you name it. So you really want to understand what you can do to get those out. And I don't have enough time to go through that today. I will cover those in future podcasts as well, and maybe have some guests on here that can help us understand that even better. But toxicity is a huge thing. So remember, when it comes to diabetes or any chronic disease, your body doesn't need any help healing. It just needs no interference. So make sure you're keeping those interferences out of your life as best as you can today moving forward, and we'll see you next time.
Thanks for listening, and we hope you enjoyed today's episode. Please help more people in reaching their fullest potential and rate, review, and subscribe to this podcast. For show notes and other free resources we mentioned today, go to newedgewellness.com.